In 2018, 67% of doctors were in favor of using marijuana for medical purposes, and 85% of adults approved the use of medical marijuana. Talbot recovery. Today I'm going to be speaking about medical marijuana. I have chosen this topic because medical marijuana has been trending recently with all of the studies going on. Through extensive research, I am credible to speak on this topic and state the facts. In my speech today, I will be discussing 3 different points on medical marijuana, which include what medical marijuana is, how it can help the body and the side effects, and why people use it. My first point will be what medical marijuana is. Medical marijuana is just about the same as regular marijuana except used for medical reasons. Medical marijuana is created from the chemicals in marijuana and is used to treat diseases and other conditions that people have. The actual marijuana plant contains around 100 or more chemicals, which are also called cannabinoids. Each different one has different effects on the body. In the article from WebMD, What is Medical Marijuana? These reliable facts are presented. Delta-9 tetrahydrocannabinol, also known as THC, and cannabinoid, also known as CBD, are the 2 main chemicals used in medicine, but THC is also the chemical that produces the high people experience when they smoke or eat products containing marijuana. In an article by Alice Park called Here's What Science Says About Medical Marijuana, it says there have been studies on medical marijuana. These studies tested marijuana's abilities to relieve spasms, depression, anxiety, and sleep disorders. Most of the studies showed improvements among the participants. However, the scientists do not know if it was from medical marijuana or just by chance. Now that I've told you all what medical marijuana is, I will now discuss how it can help the body and the side effects. Medical marijuana can help the body because cannabinoids, which are the main chemicals in marijuana, are similar to a chemical in the human body that helps produce appetite and pain. Medical marijuana can help with the human appetite, pain, memory, and movement in the body. Research shows that cannabinoids can improve nausea, anxiety, inflammation, and relax muscles. Since medical marijuana is basically the same as marijuana except used for medical reasons, the body can experience side effects from it. One side effect that it can produce is it can affect the judgment of a person and their reaction time. This can result in accidents behind the wheel or anywhere. In the article from WebMD, these facts are stated. Other side effects of this medically used drug are depression, bloodshot eyes, dizziness, low blood pressure, increased heart rate, and hallucinations. Medical marijuana has been proven to help the body, as I stated earlier, but it has side effects just like any other drug prescribed by a medical professional. After discussing what it is, how it helps the body, and the side effects, I will now talk about why people use it. Many people use medical marijuana for different reasons, but some of the main things it is used for are Alzheimer's, to improve appetite, and cancer. The only proven fact that medical marijuana has helped with is nausea and vomiting. People take medical marijuana to help reduce the risk of all of these diseases, but none of which are proven yet. It is used by many, but only few can testify to improvement in results. In the article from WebMD, these facts are stated. A few more conditions people use medical marijuana for are schizophrenia, epilepsy, glaucoma, and Crohn's disease. However, these are less common. Yes, people use medical marijuana for these conditions, but it has not been proven to cure or help any of the ones stated earlier with an exception of a few. After discussing all 3 of my points, I will come to the end of my speech. As I talked about earlier, the 3 points discussed on medical marijuana were what medical marijuana is, how it can help the body, and the side effects, and why people use it. All of these points give us a better understanding of medical marijuana. Over half of doctors approve the use of medical marijuana, and more than 80% of adults approve the use of it. But does that actually mean that it is okay to do so? Thank you.